Hello, and welcome to the HSJ Health Check Podcast. I'm your host, Annabelle Collins, and this week I'm joined by Deputy Editor Dave West and correspondent Katie Hignett. This week, we are continuing to look beyond the immediate day-to-day experiences of running the health and social care service in times of COVID. And this week, we are focusing on finance and funding the NHS. Normally, this would be at the very heart of management in the NHS, but the last few months, finance has certainly been a persona non grata as the NHS has got on with its COVID response amid promises from the Treasury that money would be no option. However, now reality is starting to come back, so I'm turning to Dave. Are you able to give us a brief update on where we are at the moment with finance and the health service?
Yeah, thanks, Annabelle. I can try. As various things I wanted to say about it, in particular how much it's how much I think the crisis has totally upended the world of NHS finances and what we're used to. But as you alluded to, finance has been less front and centre in the way the NHS has been managed since the start of the outbreak, and that has come with much less transparency. One of the aspects of what's changed is much less transparency and public information about what's going on with NHS finances. But what we do know is that at the beginning, in the very early stages of the crisis getting really serious for the NHS in early to mid March, the government Treasury made it clear it would that money would be no object and it would pay for whatever it takes in terms of the NHS response to the virus. And so that was taken at its word for the period of around a couple of months, and there was huge spending, much less checks on what was being spent. And we'll hear from Katie Hignett, who's on the podcast later, about some of the examples of that which are now emerging. But I think we have now been gradually coming out of that kind of spend whatever you want to and whatever you can, frankly, on the crisis response into a different phase, and that began probably about a month and a half ago with NHS England saying, actually, we're not just going to kind of sign everything off or allow you to spend without even any sign off anymore. You are going to have to, for big kind of crisis related spending, capital spending and that sort of thing, get sign off through more normal processes. But it did allow substantial other kind of spending, coronavirus related spending, to continue. I think, again, we're gradually seeing aspects of reality, of financial reality, returning to the running of the service and the debate about the service. And for example, over the last 2 weeks, we've seen NHS England officials telling committees in Parliament that they are in negotiation with the Treasury effectively over a number of important aspects of the next phase for the service. So going back to more normal times where they need to ask for where they need to go to government to get permission for things, and they're kind of in a tense negotiation essentially. And some sources have said that the Treasury is actually being pretty aggressive, back to its sort of normal ways, about why is it costing you quite that much, NHS. And so the things they're requesting funding for up front, the things the NHS is requesting funding for up front, include keeping the Nightingale hospitals sites there in case of another spike or surge or second wave of coronavirus. They want to keep the Nightingale temporary hospitals in place in case they need them in that event. They want money to guarantee that they can pay for continuing to use a lot of independent sector healthcare capacity to carry out operations, try to reduce waiting times for operations, which have gone up a lot with hospitals not being able to do most of their normal routine operations, and try to prevent the waiting list, which is expected to surge up to 6, 7, 8 million or beyond over the next few months. Try to keep that down by using as much private sector capacity as they can. Will the Treasury pay for that? We don't know yet. And there's a number of other things that are being requested. Another example, the NHS wants to prevent hospitals filling up. The hospitals are still, generally speaking, a lot emptier than they were in a sense, and at the beginning of the outbreak than in early March, because fewer people are still coming in, because there's been much faster, and because operations are still not happening at the normal rate, and because discharge has been much quicker. There was an alternative discharge system put in place to ensure that when people were ready to be discharged out of hospital, that more often than not nearly always happened within 24 hours. Why was that able to happen? A few reasons, but especially because basically the Treasury and government guaranteed they would pay for that, for whatever onward care the person needed, whereas normally there's a kind of vexed and horrendous complex discussion about who needs to pay for it and where they should go, etc. And there's a discussion now with the Treasury, NHS England is saying, well, we need to keep this in place so that hospitals don't just fill up again, and because it's actually broadly a good thing to do to get those people out of hospital as quickly as possible into somewhere where they've got more a pleasant sort of environment and a better place to be cared for, generally speaking. But the Treasury again hasn't yet guaranteed that it will back the funding for that in the way that it has so far. So that's some of the discussion that's starting to bubble up. Annabelle,
do you think there's a nervousness in the sector at the moment about that kind of lack of commitment from the Treasury? Because obviously there's a lot of talk at the moment about a second peak, and we don't know when it's going to happen. We're already seeing obviously Leicester and some other bits of the country where it's bubbling up again. It seems that a commitment to give that financial support is needed sooner rather than later.
Yeah, and they have said, they've talked about imminently and this week and next week. And I guess that when we get this phase 3 guidance letter from NHS England, that will be the kind of white flag going out that actually the Treasury has agreed to whatever, to something, and whatever it's agreed to will be detailed in the letter, presumably, and the NHS told to sort of get on with it with those parameters. But I think, there is nervousness. Either Leicester, the thing about the sort of outbreaks in Leicester and elsewhere, in terms of hospitalisations, it's still tiny. It is not, I know that hospitalisation kind of lags the outbreak of cases, but this is clearly, it's really important to spot those local outbreaks and do something about it. But the NHS is still really nowhere near, in terms of the coronavirus patients, is absolutely nowhere near where it was at the end of March or into the middle of April, even in Leicester. But it does, but people are nervous, like you say, especially sort of the nearer people working on the front line and things like that are nervous about going back anywhere near that kind of horrendous situation. But I think the reality is hospitals are remain emptier. There is some concern that especially in some places, the occupancy is getting back up towards what it was. But there's but crucially, the NHS would like to be able to plan to get back other services to normal, because people working in the NHS are very conscious that in all sorts of different services, very conscious that people are suffering ill health and harm and poor quality of life, and in some cases death, because other services aren't running properly, or because they are not seen to be running properly. So people are staying away from hospital, and what the NHS would like to do is to have the capacity, and this again comes back to both a funding thing and a staffing thing that I'll ask you about staffing shortly, but that it would like to have the capacity that even if there is a second peak, perhaps a smaller one than the one we have, but some sort of second peak, that it can keep many more services actually open and running, and that it can do all these things in a COVID secure way that's that has enough infection control in place. But that's where the massive hit to current resources and capacity comes. So whatever the NHS could do in February, it can only do, pick your number. It's hard to calculate it, but in different services. But whatever it was in February, say the NHS can do like 80% of what it could with the same resources now, because of the huge infection control measures that have to be put in place in different ways for all different services. In a simple sort of acute ward or A&E basis, you've got to split people into COVID and non-COVID sections, and that means keeping more spare capacity, more empty beds, and more kind of staff who are there to be used if they need to be, but they're not kind of occupied at the level they were before. And so that perhaps brings us on to the next question about, well, what will be funded in future, really. The NHS needs to have a sort of normally has an ongoing sort of discussion or row with the Treasury and discussion with the public about, well, this is what we're willing to give you each year, 130 odd billion at the minute. And this is what you'll get for it. Well, now, it's giving an amount which actually we don't know what it is. Perhaps come on to talk about that as well, because we don't know what the NHS or the Department of Health budget is this year, let alone what it will be next year. Whatever it is, assuming it's roughly similar after you take out all the PPE and stuff like that, the public will get a lot less for it because infection control measures and so on mean that you can do much less with the same resources.
And I was also wondering how this would interact with the ambitions in the long-term plan, whether there's been much said around that. What are the thoughts on that at the moment, do you think?
There's not been much said about it, but yeah, it's a crucial point, because the NHS thought it had a certain amount of money, whatever it was, 3.4% average revenue growth, and the long-term plan said, okay, thank you for that, relatively modest but better than before revenue funding settlement. This is what we'll get you for it, as long as you give us capital and workforce spending as well. So clearly it's we don't know what the budget is this year. We don't know what it's going to be next year, but it seems highly unlikely that it's going to be able to match delivering what because it's going to have to be spent on a whole load of other things, running hospitals and so in a much more resource intensive way, and community services in a more resource intensive way. It seems very unlikely that they will be able to achieve what they said they were going to achieve in the long term plan, and so you probably come back to, well, what's going to be sort of lost off the bottom of the list, and that's something that we and others will be looking for over the next few weeks and months. But I mean, you have to probably sensible to go back to the government's manifesto, which they have been. You'll know from watching the 50,000 extra nurses pledge that all the briefing to the political journalists about, well, Dominic Cummings keeps going on about his 40 hospitals and his 50,000 extra nurses and other things where there were commitments in the manifesto. I think there perhaps was some commitments around community and primary care and perhaps mental health, cancer. They will want to try and probably narrow down and focus on those things, and I suppose things where there's a kind of double benefit from coronavirus and from and for other care. So digitisation, it needs to happen because of coronavirus. It will also deliver some increase, reducing face-to-face outpatients will also deliver part of the long-term plan. Reforming, trying to put more diagnostics into sites that might be clean in the community may have some sort of dovetailing with the long-term plan, as well as helping with coronavirus.
And I suppose also linked to the long-term plan is the people plan from a workforce perspective. That's obviously was meant to be the key event of this year, but sort of been put on pause. But after talking to some workforcey people, waiting for a spending review was pretty key when it comes to implementing some of the things in the people plan. I think basically people are trying to get on with as much as they can without any new money, and kind of cultural stuff, I suppose, more than anything. But again, but cultural stuff and staff well-being still costs money, and I think there are some concerns about how much can actually be achieved until there's a little bit more certainty on the financials. I think also it'd be quite good to kind of get into a bit more detail costs of running the NHS at this time, and kind of bringing Katie in. You've been focusing on this in kind of many different areas, particularly PPE, and I think a good point to start might be the story that you have been working on over the last few days. Do you think you'd be able to give us a kind of a quick insight into that story, and then perhaps talk a little bit more generally about some of the things you found out?
Yeah, sure. So basically the government has kind of given the Treasury an estimate of roughly how much it thinks it needs to budget for PPE for the year. It's given itself a funding envelope. It's agreed a funding envelope rather, of in the region of £14 billion, which is for the year, which is just like an astronomical amount of money. Like that is a huge amount of money. I think in terms of kind of equivalent spending in other areas of the NHS, I mean, that is roughly sort of 10% of the NHS pre-coronavirus budget. Like this is a huge amount of money. And of course, it might go up as well. We don't know yet how much PPE will be required in autumn and winter. Obviously, there are lots of different models and estimates, but no one really knows for sure. So for our story, we kind of just went into that total figure. But in other stories and kind of ongoing, I've been looking at contract award notices, which are published pretty much daily on a website run by the official journal of the European Union. And on that website, basically all public organisations have to give certain details about contracts they've awarded. Normally, this system is used for kind of advertising tenders. It's used as a way of attracting bids for contracts. But in the vast majority of cases for coronavirus stuff so far, it's just been for announcing that this contract was directly awarded maybe a month ago, maybe 2 months ago. At the moment, it's a really interesting time to go on that website because a huge number of contract award notices are being published. It's as of last week, about 1.2 billion worth of PPE contract award notices have been published, and those are just ones concerning the Department of Health. There are other large contracts that have been published to do with trusts, local authorities, other groups that are buying that kind of stuff too. And this week, lots more have been published. And given that we now know this really big envelope, it's going to be a really interesting place to find lots and lots of, I'm sure, impressive and also unusual contracts. I mean, a couple of contracts have already gotten a lot of focus in the media. There was a PPE contract for a company called PestFix, which is a small family-run pest control company. They have net assets of around about £19,000, and they were given a contract worth 108 million.
Wow.
And yeah, so it's a lot of money, and that was for PPE. So it was stuff that they obviously would use in their day-to-day operations, but obviously are nowhere near the volumes they were required to get for that kind of money. So yeah, there's some interesting stuff going on there.
Do you think, Katie, after that, there's been that sort of storm of, they were kind of in the midst of the storm, buying all those PPE as quickly as possible to try and shore up supply and paying sort of ludicrous prices by the look of it. Has there been any sort of like slight return to normal on that? Do we have any sense of like they're still paying? Well, is the supply broadly coming in now in enough? Is enough of it there, and will it continue? Do we expect it to continue to be enough of it there through the year, or is there going to be like another big shock? And do we have any sense of like if they're paying slightly more sensible prices now, or not?
Yeah, I mean, to be honest, it's hard to know exactly how sensible or ludicrous the prices that central government has been paying. So the Department of Health, for example, has been paying for PPE because the department has been very reticent to release the volumes of products involved in each contract. We've kind of worked it out for a few of them, but just a handful. And the ones we worked it out for, some of the prices aren't too astronomical per item, but we also know from looking at local board papers, for example, that lots of trusts, even ones that are buying in very large volumes, have faced much higher prices than normal, and that absolutely makes sense because of the supply and demand issues for all of these items, because the majority of PPE is still made in China. which obviously was the original epicenter of the virus. So capacity was down in factories and local demand was really, really high. And although those initial factors have to a degree resolved, China is no longer one of the countries facing particularly high rates. It is certainly not going to be plain sailing from here. It is the case that in Europe, so the UK, for example, we have much lower rates of coronavirus infection than we did a few weeks ago. That's true in much of Europe, but globally, the infection rate is growing. And so demand for PPE, in theory, will also raise. So in the US, for example, which has been one of the biggest buyers of PPE and one of the most aggressive buyers of PPE, their demand is only going to go up from now, given how the infection rate is rising every single day. And other countries like Brazil, for example, very, very high infection rate at the moment, also looks like it's continuing to rise. And like I said, the World Health Organization, I think either the end of last week or beginning of this week, warned the world that overall infection rates across the globe are going up, not down. And so that demand for PPE is going to be there for the foreseeable future. Although it seems like a lot of the issues that we were facing in the UK a few weeks ago with these very acute shortages, it seems like a lot of that has calmed down. I still hear from procurement sources quite regularly that they're concerned about the supply of particular items. Gloves are an issue at the moment, for example. It's definitely not resolved, and it looks like it's going to be a difficult situation, I don't know, for the foreseeable future.
The long haul, yeah, it's it's a reminder that on that in particular, but also on, if I was thinking about things like what kind of hospital capacity do you need in the winter and what will that cost? Well, a lot of it depends. You're completely at the mercy of what the virus decides to do, in respect of coming back for second peaks or not, and so on. And also science still plays a big part. Science will still play a big part in terms of, we've talked a lot about testing on the previous podcasts, but if depending what actual tests are available and work, are widespread, rapid, effective, accurate tests available, then that changes how you would run a hospital as well, and probably changes how you would use PPE and that sort of thing. But and Annabelle, you mentioned the people plan and that limit. The other thing that you that the NHS's people running the health and care services are coming up against when they're thinking about, well, could we actually massively expand services if the Treasury is willing to pay for it, so that we can keep the kind of health and care that people need available. They then come up against, well, could we staff those extra wards or whatever, even if we wanted to? What's your sense of the thinking on that?
No, absolutely. I think the NHS is in quite an interesting position, because talking to people, particularly kind of around recruitment, they're saying that they've never seen so many kind of hits on the particularly HEE careers website. And I think there's a real feeling that, and I've sort of been told that the UCAS stats coming out next week will reflect that there is this interest in a career in the NHS. I think that reflects what's going on in the economy at the moment. I think there's a lot of job uncertainty, and I think the NHS has been prevalent in the news, and people are perhaps looking to that as kind of a potential career, as like a stable career, potentially looking to join the NHS. But it doesn't, it takes a while for somebody to qualify, particularly a nurse or a doctor. The apprenticeship scheme isn't really utilised that well for nurses. So I mean, that could be a route in for some people. But I mean, even if there are more healthcare assistants, I don't think that's going to be enough to kind of staff, I don't know, extra community beds or extra wards or whatever it is. I think, and then I've said kind of many times on this podcast before that the pressure on international recruitment means that what used to be seen as a kind of a short-term bit of a quick fix for the NHS isn't really available anymore. Well, at the moment at least, and it will take a little while for that to get started again. So unless the returners stay in the NHS, which, is possible. I think some of the retirees certainly won't. Many of them didn't take on a frontline role anyway. They were kind of more CPD focused, kind of supporting other people in redeployment. I think, unless some of the returners are kept, then it will be very, very difficult to boost staffing in any meaningful way.
Yeah, in the short term, certainly, perhaps in 3 years' time, there'll be some kind of benefit from the unemployment elsewhere, but short term doesn't look a pretty picture.
No, absolutely. All right, I think we've just come to the end of our time this week, but thank you both so much for joining us. A really interesting topic to get into, and thank you for listeners too. Just to remind you all, as usual, the HSJ Health Check podcast is available each week on the hsj.co.uk website across all main podcast channels. Please do subscribe and share and get in touch with me or anyone else in the team if there's something you'd like to see us discuss. Thank you so much for listening.